Dr. Héctor Carvallo, Nati Professor, University Abierta Interamericana, Argentina, ivermectin and carrageenan in the prevention of COVID-19. Professor Carvalho is a former professor of medicine at the University of Buenos Aires, as well as the former director of the Ezeiza Public Hospital in Argentina. Currently, he's involved in the development of strategies to defeat SARS-CoV-2 and has been a vocal advocate of ivermectin. Recently, he was appointed as the editor-in-chief of the newly released OAJ Research and Applied Medicine. So, Dr. Hector, I have discussed your bio before as well. What a wonderful body of work you have. So welcome and let us start. So Dr. Hector will be talking about COVID and long haul.
April 2020, and the results were duly submitted on July 2020, in which we explained what we had done either for prophylaxis in COVID-19. And these are the 12 peer-reviewed articles, which I include here, just in case you are interested of looking for them and taking a look at them. But relax, I'm not going to talk about each of them. Dr. Laurie requested me to talk just about one of them, which I'm going to do later on. As I said, we worked with ivermectin either for treatment or prophylaxis, or if you prefer, for pre-exposure and treatment. In the case of the treatment, our protocol was called IDEA because of the acronym of ivermectin, aspirin, which are used together in the mild cases, and dexamethasone and enoxaparin, which are added in the more severe cases. Right here, you may say, hey, wait a minute. Everybody knows that dexamethasone works for COVID. I give you that. But we started using them on our patients on early March 2020, and their recovery trial was released 2 months later. So everybody is wise with yesterday's paper, but we started using it long before recovery trial. And the prophylaxis, that we had two different protocols, one with ivermectin alone, which was called Iverprev, and the other one with the addition of carrageenan, which was called Ivercar. I'm sure that the ivermectin mechanism of actions are going to be mentioned repeatedly during the conference, so I won't stop in this. But I have to explain what are the carrageenan mechanism of action. First of all, carrageenan is a compound which is used to thicken any product, from gastronomic products to medical products. But some about 5 years ago, it was discovered that carrageenan had a virucidal effect by itself. And the mechanism of action against virus is either direct or indirect. The direct effect is because of opposite electric cargos. In the case of the COVID-19, carrageenan has negative cargos and the virus had positive cargos. So one attached or adhere to each other like a magnet on the door of a fridge. And such an wrapped virus loses its capacity to infect the cell. And the indirect effects are because of the competition for receptors. This is something that we are going to see repeatedly during the conference. It's a meta-analysis that has been done over 50 trials with almost 400 scientists working on them and about more than 15,000 patients. And all of them have proved to be positive. They have all had positive outcomes. But as you may see here, early treatment has more percentage of improvement than late treatment, which is a dogma of medicine. Any disease which is treated later will have less chances to get better. So the earlier treatments are far preferable. And this other one shows how ivermectin has been added to the treatment of COVID-19 in about 1/3 of the world, from Alaska to Ushuaia, Argentina. And you may say, is this official? No, because unfortunately, we couldn't count on official authorizations. Some of these countries, which are in light green or dark green, have authorized them officially, but in some others, the use is unofficial because people keep dying out there and they need something, and something that works. So mostly all South America, all Central America, in North America, including Alaska. I believe in Canada it's being used too, but in a lower number. In Europe, 2 countries have authorized it officially, which are the Czech Republic and Slovakia. Also, Macedonia has authorized it, but Macedonia is not a part of the European Union. In Africa, this continent should be in green, all the continent, because all the continent uses ivermectin. But the countries which are not marked here have been using ivermectin for decades in order to treat river blindness, that is onchocerciasis. That's why they are not included, because they simply don't have COVID. The countries like Egypt or South Africa that added ivermectin for the treatment of COVID later on, they are included. Also in India, with millions of patients treated, in the Middle East, Japan, and so on, and counting. And now, as I previously mentioned, we want to say a few words about long COVID patients. We have used ivermectin for pre-exposure, exposure, early treatment, late treatment, and even after dismissal from the hospital for those patients that hadn't used it before. And this is a peer-reviewed article called Ivermectin in Long COVID Patients Retrospective Study. It was performed by both myself, Dr. Hirsch, and Dr. Haroldo Del Franco in a public hospital in the province of Buenos Aires. This follow-up was conducted on 856 patients discharged from hospitalization at that hospital from July 2020 till now. And those patients had not received ivermectin either before or during hospitalization. So they were, so to say, virgin of ivermectin. They had received corticosteroids, antibiotics, blood thinners, convalescent plasma, whatever, but not ivermectin. Because the truth is that if they had received ivermectin, they wouldn't have become long haulers. And that's a fact. From these 856 patients, almost 800 were included for ambulatory control with ivermectin in post-COVID, but 57 were not, because they developed paranoid disorders after dismissal, so they had to be referred to psychiatrist facilities, memory loss that were suggestive of dementia, so they had to be sent to the neurologist. Dysgeusia, mainly mixing salad and sweet sensations, but due to other otolaryngology issues. So they had to be sent to otolaryngology service. Fatigue, but it happened to be caused by anemia and or oncologic issues that had not been previously diagnosed. So they had to be referred either to hematology or oncology. These patients, all these patients, 57 patients that were not included in the study had been at the intensive care unit for over 10 days. The other group, the 799, they had noted that after dismissal from the hospital, the symptoms kept present, were still present. And those symptoms were coughing, but not related to previous history of cold, brain fog, not related to any other neurological cause, headaches, persistent fatigue, loss of taste or smell, shortness of breath, and body and joint aches, with no related history of arthritis. All these patients, almost 800 patients, received ivermectin ranging from 12 to 18 milligrams per mouth on a weekly basis. You know, up till now, you know we are the weekly basis guys, until the symptoms disappeared, but no longer than 8 weeks. What happened first? Some of them also received polyvitamin compounds, but they did then that an auto prescription, and there were no more than 12 patients, so we didn't take them out of the cohort that was studied. The average time needed to get rid of the symptoms mentioned before were 33 days, ranging from 21 to 69 days. The side effects reported by ivermectin were diarrheic episodes in 5 patients and abdominal pain in 2 patients. No cases of allergy were reported, and as long as there were no pregnant or lactating women among this group, we didn't have to take into account the possibility of discharging these subjects from the study. The conclusions of the essay is that this long COVID includes a constellation of symptoms that may be caused by unobtrusive persistence of virus in different tissues and the subsequent persistence of inflammatory and coagulation disorders. Since ivermectin has already proved to impair virus capacity to invade cells and also to have immune and clotting modulatory effects, which are, in my opinion, the most important, there is a reasonable chance to diminish, shorten, and even completely correct almost all the symptoms by using ivermectin in the post-COVID if it had not been used before, because if it had, there wouldn't be long COVID patients. And the general conclusions are this. During this year and a half of pandemic, we have had to face 2 powerful enemies. One of them is merciless, relentless, tireless, lethal, polyphacetic. The other one is just a virus. So we have to behave like kites. The stronger the wind against us, the higher we must fly, because the consequence of that flight is the life of our patients. Thank you so much, and I'm open to eventual questions.
Dr. Carvalho, thank you so much for your discussion. What a wonderful discussion and important messages there as well. So I have a few questions as well, if I can have you back here with us. I think you are on mute as well.
Yep, I'm here.
Excellent. So great talk. Thank you very much. So I'm going to start with some of the questions that are here. One question, what is the age range to whom ivermectin is recommended, whether as prophylaxis or treatment for COVID-19? What is the dosage and frequency of intake?
Well, we have used it for prophylaxis, that is pre-exposure, since 12 years of age until, well, there's no limit.
And is there any contraindication then for any age?
No, actually, before the pandemic, the doctors, the specialists who knew more about ivermectin were the pediatricians, and the dermatologist, because they used it from 2 years older or for 15 kilograms of weight on, for scabies, ectoparasitosis, enteric parasitosis, and so on. But we didn't use them in that group, in the pediatric group, just because it seemed not to be necessary in the first wave, because children were not effective. Just a few children developed Kawasaki syndrome, PIMS, but most of them didn't develop severe symptoms. They were affected, they contracted the virus, and they uh, could be contagious, because the worst contagious situation is the one with the patient that doesn't know his condition. Mm.
Hmm.
So they were asymptomatic patients, but they could transfer the virus to anybody else. But
Got it.
now, during the second wave, we are seeing with a concern that the new variants are affecting younger stages, younger ages. The Brazilian variant, the Manaus variant, which is close at hand because we are neighbors with Brazil, affects children. So we are starting using prophylaxis
Hmm.
from 5 years on.
Got it. And quickly, two more questions on the same one. One is the dose, and the second one is any side effects that you would like doctors to be aware of.
Well, in Argentina, there are more studies than ours. One was conducted in the province of Tucumán, and it was a very nice trial, very professional, and they standardized the doses, and they found out that by standardizing the dose, the outcomes were not as good as when you attach the dose to the weight of the patient. That is when you personalize the dose. And the dose we use here is we use the liquid um, product, um, and we use 2 drops of ivermectin uh, to begin with for the treatment, and 1 drop per kilogram. I'm talking 1 drop for prophylaxis. When we want to change it to pills, we get the number of drops we have been using, and then we divide it by 30, and we have the quantity of pills, because our pills have 6 milligrams instead of the American ones that
Got
have
it.
3 milligrams.
Three
So
milligrams.
you have to divide by 15, Dr. Bean. You have to divide by 15. But anyway, talking about the dose itself, we start using from 0.2 micrograms per kilogram for the prophylaxis, and 0.4 micrograms per kilogram in the treatment. In
Got it. So
the
0.2 milligram per kilogram to 0.4 milligram per kilogram. Thank you very much.
correct.
Next question. So we have a tons of questions. I want to quickly go through them. Another question that is very interesting, and I think this is a key question. Uh, Somebody has asked that if I want to convince my family members that ivermectin is useful, this would be a situation with the doctors as well, one doctor convincing another that it is useful, it is efficacious. What is How do we tell that? How do we convince someone?
Well, first of all, I don't want to convince anybody, because in my 40 years as a medical doctor, I have divided the lecturers into 2 wide groups. The one group which wants to share an opinion, who wants to share an idea, and the other group who wants to sell a product. I'm not here to sell in a product. Any of us is now on Sunday evening trying to sell a product. So it's not a matter of combining people. Um, it's easier to combine your beloved ones because they rely on you. It's easier, far easier than combining the authorities. But that is because they have have millions of reasons to remain reluctant.
Got it. Got it. Thank you. So one question from Dr. Teslari, who is here. So what was the rationale for the weekly dosing in long COVID? Some doctors, such as Dr. Agira Chang in Peru, give 2 to 4 days initially.
Well, if it works for him, it's good. I've seen so many different doses, so many differences in the intervals, and that the only thing that you can take from all those differences is that ivermectin works, because no matter how you use it, it works.
Got it. And audience, we are trying to answer as many questions as possible. The questions are outstanding questions are 144. So we clearly cannot reach to everyone. We are trying our best, and we'll continue to do follow-ups as well. Dr. Carvalho, one more question. It is from Edmund Fordham. The question is, what is Dr. Carvalho's view of the relative importance of ivermectin versus topical carrageenan in his prophylaxis regimen?
Well, topical carrageenan has proved to be very effective. We have developed a trial at the May 2020. We used it together with ivermectin, but some other colleagues have used it alone. And there's a new trial which has been released in Europe, in Austria, that also proves the effectiveness of carrageenan to reduce the possibility of contracting the virus. I think that carrageenan is a wonderful alternative for those cases in which we cannot use ivermectin for prophylaxis,
Got it.
such as pregnant women, lactating women, young children, because carrageenan is also present in maternal milk, the milk that is sold instead of natural milk. So if it is there for lactating children, it means that there's no problem with using carrageenan in children.
Got it. So one more question on carrageenan. What strength are carrageenan nasal? So I think they're trying to ask strength and the type. Is it nasal spray, mouthwash?
Sorry, Dr. Bean, before that question, I saw a question there that said, there's plenty of carrageenan in Ireland. Yes, carrageenan was discovered in Ireland 500 years ago. Okay, so the question was?
Carrageenan strength, nasal spray. Is there a carrageenan nasal spray and a mouthwash as well? And type of carrageenan?
There are two types of carrageenan. One for the nasal spray and the buccal mouth spray. Anyway, you can use the nasal spray both for the rhinopharynx and the oropharynx. It doesn't taste very good because it's too salad, but anyway, it works.
Got it.
We never said that it would taste good.
Got it. It's a medicine. So one more question. Luis Hernandez says, Dr. Carvalho, what is the individualized dose nowadays for long haul? So what dose do you use for long haul?
We are using from 12 to 18 milligrams per os. So we attach to a schedule to make it easier.
Got it. And one more question from Andre. He's saying, have you have any experience in using ivermectin plus nitazoxanide or fluvoxamine? So
no.
Do you use any combinations like that?
No, we haven't used it with other antiparasitic compounds, and not with any drug that may be used to reduce prostate cancer. But the fact is, there's one drug that we have used that has kept disregarded by most of the scientific community, which is bromhexine. Bromhexine is used for a simple catarrh, for stop coughing. And bromhexine has proved many years ago that is as strong as tocilizumab and nafazostat to block the TMPRSS2 receptors. And the fact that it wasn't used for that reason is because it's too cheap.
And just to add a quick comment here, I've done a lot of study about the bromhexin as well. So bromhexin is a TMPRSS2 blocker, as Dr. Carvalho just mentioned. And interestingly, ivermectin is also a TMPRSS2, or basically a protease inhibitor as well of this type. So it is an interesting combination. Dr. Carvalho, one more question. Laura Chamberlain says, you did not post the result of your study. Did 100% of the long COVID patients results in the 8 weeks of the study? Or they they become corrected or cured in the study?
No, I don't quite understand the question.
So is the long COVID data that you shared, is that a study, number one, and did everyone recover when you use
Absolutely,
this?
absolutely. Sooner or later, from with an average of 36 days, everyone recovered.
Got it. Cool. So thank you very much, Dr. Carvalho. Your work has been great. The studies have been great. The data has been great. I cannot imagine the amount of contribution that you have done. Tell me this, one last question from me. What is the situation in Argentina? How much is ivermectin used or not used? What is the political and clinical situation there?
On the record, for the record, there are 6 provinces which has already adopted ivermectin, both for prophylaxis and treatment. The 6 Argentinian provinces. Argentina is divided into provinces, as the United States is divided into states. So a state is a province. And the rest of the country is using it off the record. I guess there's no more well-known compound in Argentina, as far as COVID-19 is referred, than ivermectin. I can tell you, though I cannot prove it, but I can tell you without lying that even the authorities are using ivermectin. Even the ones that are supposed to authorize it are using it.
Very interesting. So once again, tons of thank you for coming in, for your data, for your video, and for your answering those questions. Thank you so very much.
You're very
So
welcome.
audience, once again,